Vohra Miller, and I am the co-founder of the South Asian Health Network. I would like to start with a land acknowledgement. So the land I am on is a traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. The South Asian Health Network is a grassroots volunteer-based organization that has been advocating for and providing accessible scientific information to the South Asian diaspora in Canada. We have a wealth of information on our website. You can find us at southasianhealthnetwork.ca. And the South Asian Health Network is so honored to partner with these incredible community organizations, with special thanks to CASA, the Council of Agencies Serving South Asians, as well as Toronto Public Health. With that, I would love to take some time and introduce our two incredible speakers for this evening, both leading South Asian physicians in their fields and two extraordinary women that I deeply respect. Our first speaker tonight is Dr. Ruchi Murthy. Dr. Murthy is an infectious diseases physician originally from the GTA, now based in Ottawa. She entered the pandemic with the unique perspective of being a pregnant mom as the pandemic began, delivering her baby during the pandemic and now working as a new mother in infectious diseases. She's been navigating this pandemic along with so many new moms, inspired by her sister, who also became pregnant during the pandemic, and is keen to share her insights as an infectious diseases doctor to all. Our next speaker is Dr. Kaajal Abrol. Dr. Abrol is a reproductive endocrinology and infertility specialist in Toronto. Dr. Abrol completed medical school at McMaster University, residency in obstetrics and gynecology at the University of Toronto, and fellowship in gynecologic, reproductive endocrinology, and infertility at the University of Toronto. Dr. Abrol is passionate about increasing knowledge and awareness about reproductive health to empower women to make informed decisions about their own fertility. So welcome everyone to tonight. I just want to make sure and take some time to understand if our YouTube channel has been working in Punjabi, and perhaps if tech could take a quick look at that and make sure that we are all okay in Punjabi on YouTube. Thank you. So we would be remiss to not begin the session by acknowledging that what is happening currently in India is a massive humanitarian crisis. South Asian Canadians are fighting two pandemics, one here in Canada and one in India, where many of us have family and friends. The number of infections and deaths in India are vastly undercounted, and millions of people are left without access to critical medications and vaccines. The South Asian Health Network has compiled a page on our website where we have included resources such as real-time databases with critical necessities and also home care infographics created by international physicians in the India COVID SOS group. We've also listed various fundraising efforts, both Canadian and international, on our website. So with that, I would like to open the floor and ask if any of our speakers tonight would like to say a few words about the situation in India.
Sure. Thank you, Sabina. I think that our hearts really are in many places these days. And I know personally in my family, we've lost someone very special this past week. And so I'm thinking of my family back in India and South Asia as a whole, and how they're suffering and trying to come out of this. As an infectious disease doctor, it's hard not to feel a bit helpless sitting halfway around the world. But I think all of our thoughts are really with India, and I really commend your efforts in doing what you can to share valid, credible information to people, and hoping that the people across the ocean are gaining from that information as well.
Absolutely. Okay, so with that, what I would love to do is open up our session to our topic for tonight, which is on reproductive health. And what I would like to do is try and talk about some of the questions that all of us have been receiving. So I moderate an evidence-based parenting group, a mom group on social media. I also have a blog called Unambiguous Science. And one of the topics that I keep getting very often is whether COVID vaccines are safe in pregnancy, whether they're safe in people who are trying to conceive. And understandably, this is a very worrisome time for people, for new moms, for expecting parents, as well as those who are trying to get pregnant. So I'd love to take some time and get some, advice, and also some, have this open dialogue and discussion with both of you tonight. So perhaps if we could actually start first with Dr. Murthy. I'm going to start with you. Pregnancy was recently bumped up to the highest risk category for vaccine prioritization in Ontario. Why is it important for pregnant people to be vaccinated?
That's an excellent question, Sabina, and I think it's really important for pregnant people in Ontario and around the world to understand that pregnancy in itself is a risk factor for severe outcomes from COVID-19 infection. What we started to learn when this infection initially started, in fact, when I was first pregnant, towards the tail end of my pregnancy last spring, and we were hearing about the COVID-19 virus and trying to learn what that meant for pregnant women, I took a vested interest personally. And at those initial stages, we were getting data from Wuhan indicating that there were very little outcomes in women. There were only a handful of cases, and it seemed, if anything, maybe a bit reassuring. As time went on, I think that we've learned so much more from 2020 March until May 2021 about what this really means in pregnant women, which is, like so many other infections, marred with potential for more severity, potential for more hospital admission, and very severe illness as well. What we didn't have when I was still pregnant was access to a way to avoid this infection, which is a vaccination. We have access to this vaccination now, and we're getting more and more resoundingly supportive data to support its use in pregnant women and the safety profiles that these vaccines have. And so that's why I think it's been a very smart move to bring pregnant women to the forefront of vaccination access, and to continue to be mindful of them as we move forward in this pandemic.
Yeah, it's so important to make sure that we are mindful of this population that, as you mentioned, is at a higher risk. So Dr. Abrol, what vaccines are pregnant people eligible for right now, and how do these differ? Is one better than the other?
I think the short answer is we don't, we want people to get what they have access to. At this point, we all have access to two vaccines, the two mRNA vaccines, so Pfizer and Moderna, and one isn't preferred over the other for any population, particularly the pregnant population. I would say most of the time you're signing up for a clinic, you don't know which one you're actually going to get till you get there, and that is okay. I have a handful of friends and family who'll text me while they're in line and ask if they should get this particular one they're being offered. The answer is yes. Pregnant women are eligible for either of those, and either of those are good, and not just good enough, but good. We want you to get either of those.
Amazing.
And the Society of Obstetricians and Gynecologists of Canada, so the SOGC, to me is it's a national organization. They oversee Obstetricians and Gynecologists of Canada, and they have a lot of good recommendations, and they echo this. They want patients who are pregnant to get whichever of these vaccines they get access to.
So whichever vaccine you can access to is the right vaccine for you. Amazing. Okay, Dr. Murthy, is the dosage and schedule the same for those who are pregnant? NACI recently recommended a 4-month delay for between the first and the second dose. Is this the same for pregnant people as well?
Yes, and I think that a lot of women have asked me this question that are pregnant, questioning the delay for the second dose. And the truth is, we're still learning what that delay looks like. In theory, it makes complete sense to delay that second dose to give your body's immune system a chance to get the most bang for its for its buck, if you will, by delaying that second dose. The studies, on the other hand, did indicate either a 21 or 28-day duration for your second dose, which is why I think there's a bit of maybe nervousness or anxiety about delaying that second dose, but very credible resources, our national authorities on vaccines, have decided to make this decision. I will be forthright in saying that there are certain populations that have immunocompromising conditions, weakened immune systems, that have been protocoled to have the vaccines at a shorter time frame. Pregnant women haven't entered that category for several reasons. The most important probably is because pregnant women have shown vaccine response with just one dose. They've shown some response to this one dose to give them a bit of protection. And so they're not in the category of people that may not get any immunity with one dose. And so there's still a lot to gain with that one dose. And that's why the vaccine schedule as of now makes sense. I do have to say though, some of this is supply dependent, and as we're getting so much more vaccine coming in to our country, and we're hearing more and more reports from the federal government about more vaccines coming in, I do wonder if that time frame may change as access changes. So I'd say for now, it's probably safe and incredibly reasonable, but stay tuned because that could change in the coming weeks.
Amazing. Okay, so Dr. Abrol, what does the efficacy look like in those who are pregnant? And, you alluded to a little while ago about how, both vaccines are great vaccines. Does the efficacy of these vaccines differ in people who are pregnant versus other adults?
Good question. Ruchi might know a little bit more about this than I, but as far as I know, the efficacy looks as good in the pregnant population as the non-pregnant population.
Absolutely.
They're not behaving like, often we talk about pregnancy being a slightly immunocompromised state, and I think that's where the question from pregnant women come in. But they're not immunocompromised to the same extent as somebody who has on active chemotherapy or, has had a transplant, an organ transplant. And so they're not behaving like an immunocompromised state in response to the vaccines. And as a result, we think efficacy is as good as a non-pregnant state or similar as far as we know so far.
And there have been studies to back this up as well. There's a really good paper that came out at the end of March by a group based in Boston at the Brigham Hospital, which was published in the American Journal of Obstetrics and Gynecology, which was published by Gray, which basically looked at vaccinated pregnant and non-pregnant women, and there was no difference between both groups. And in fact, in that paper, and we'll probably get to this a little bit later, they were able to demonstrate that protective antibodies were found in the cord blood, which is what basically connects mom to baby. And Kaajal can probably explain this much more eloquently than me, and which was one of the interesting signs that we saw out of that paper as well. So yes, Kaajal's absolutely correct. And there is data coming out literally day by day to support this even further.
Yeah, I think that during the pandemic, especially having some good news and good hope is so needed. And to just get that information, with some of these, like, as you mentioned, some of these antibodies in the cord blood, it's just really, really exciting to hear about, and also really reassuring for pregnant people. So it's amazing. So yeah, we will definitely come back to that because I want to spend more time to talk about this, and it's extremely, important. So for sure, we will hold that thought and we will come back to it so we can actually dedicate a lot of time to it. The other thing that people are very concerned about is just safety. So we talked about the efficacy, there not being a huge difference or any difference in those who are pregnant versus adults. What about safety? And maybe Dr. Murthy, I'll start with you, and then I'll have Dr. Abrol add in any as well.
Absolutely. So I think the concern about safety emerged probably about when the initial vaccine came out, and there was a lot of advocacy for pregnant women getting the vaccine. And there were people that were apprehensive or questioning whether or not it was safe because, truthfully, the original trials didn't study pregnant women. Data is emerging. We are learning more information day by day. And most recently, there was a very important paper published in the New England Journal of Medicine, which is a very important journal, which looked at the efficacy of mRNA vaccines, which are the Pfizer and Moderna vaccines that you're getting exposed to. This basically is a paper that took data of approximately 4,000 pregnant women, and they followed them to the end of their pregnancies, and there were over 800 pregnancies that were followed through at that time that the initial paper was published. There were no concerns about safety outcomes comparing those that in both groups. It seemed incredibly safe in the pregnant population between those that were vaccinated and not. No signals for concern even in earlier trimesters in that paper, in the first or second trimester. Essentially, everything that made sense and about how these vaccines worked and how safe they were proven by this data that came out in this very credible journal. And so personally, I thought this is incredibly reassuring for so many pregnant women out there to know that they don't have an increased risk of congenital abnormalities, fetal loss, or complications with their pregnancy when they're exposed to vaccines versus not, or compared to a population that hasn't been. So that's incredibly important to know.
Amazing.
I'll add to that a little bit. I see, as a fertility specialist, I get patients pregnant and then I see them off after the first trimester. And I can tell you, COVID, pre-COVID, vaccines, anything else, people are very protective of that first trimester. We all are. It's a very precious time, but a lot of the stuff that we say we shouldn't do or can't do, there isn't necessarily a medical or scientific basis to it. Yes, we know there is a higher risk of miscarriage in that first 12 weeks. And I think that's a big reason why people are very protective of it. You know, I see a lot of patients that once I get them pregnant, they're like, okay, but we'll just wait till after the first trimester and then we'll get the vaccine. I think the big message is from these studies and also from the early trials of the vaccines where people reported pregnancy, they weren't supposed to be pregnant in these trials, but there were a handful of trials. There didn't seem to be an increased risk of miscarriage. There was not an increased risk of birth defects. And these are the key things people worry about, miscarriage, as well as birth defects, because it's in that early stages where all the organs and the parts are developing. And so these are the two key concerns I hear a lot from patients. And I think it's really important to acknowledge those two things from these trials. Yes, they're early trials. We don't have 5 or 10 years of data, but we're not going to have that right now while we need to make decisions on patients now. But I think people should get some reassurance, some peace of mind to know that there's not an insignificant number of women have been pregnant and had the vaccine and not had adverse reactions.
Yeah, that's.
And Kaajal, can I ask you a question? And so I've talked about this with other people about how sometimes we don't appreciate how much miscarriage and fetal loss does happen, unfortunately, in that first trimester in a normal setting. Like, I don't know if we talk about that enough as right. Women, as physicians.
You're right. So we know that in the general population, in the younger population, a first trimester miscarriage is as common as 15 to 20%. Yeah. And that number actually goes up above the age of 35. So it's not a small number to begin with. And if you miscarry, it isn't because you got the COVID-19 vaccine, right? Like, so we can't correlate one with another. We have to respect the fact that there is already a not insignificant risk of miscarriage.
Totally.
It's a very important point that you bring up.
Yeah, and literally in that New England Journal of Medicine paper where they talked about this, they take those statistics about what you expect within a certain time frame, and they put in that chart what percentages they saw in those that got vaccinated, and there was no difference in both categories. And I think that's so important to say. Thank you.
Yeah. So like to summarize, essentially, we don't tend to have clinical trials for any medicines or vaccines in pregnancy, but we do have a lot of data coming out right now from a variety of different real world registries, et cetera, some from the clinical trials for these COVID-19 vaccines. And when we do these trials, what we're looking at is to see whether there is a difference from baseline risk, if there's actually any increased risk from that baseline. And we saw absolutely nothing so far with the COVID-19 vaccines.
Yeah.
And so this is so incredibly reassuring to know, and, you know, just to empower people with this information. It's just so incredibly important. So thank you. Just to get into maybe some of the nuance, we talked about pregnancy. Overall, we talked about first trimester. The question that sometimes comes up is what happens if you get the first dose and then while you're waiting for your second dose, which we know here in Canada is 4 months, what happens if you actually get pregnant in between those two doses? Does it change anything, or is there something that people need to be you know, concerned about, or can they still get their second dose? And maybe Dr. Abrol, you want to start?
Yeah, sure. You continue on. You get pregnant. That is great and amazing. And you continue on with your second dose. And it isn't an issue because it's the same as us sitting here recommending people who are pregnant, early in pregnancy, middle of pregnancy, towards the end of pregnancy. We're telling people to get their vaccine when they have access to it. So I would say it's no different. You know, I see the infertility population. And so there was a big question on, you know, first or second dose, do I stop treatment in between? And when doses were 3 to 4 weeks apart, it's very easy to say to somebody, just take a cycle off, get both of your doses, get fully vaccinated, we'll restart treatment after. I cannot imagine telling all of my patients to just take a 4-month hiatus. So we're not telling patients, it doesn't, again, we want them to be protected, and you're significantly protected after even just one vaccination. And we're not stopping treatment in between. So I have a handful of patients who get pregnant in between and will get their second dose when it's time to get their second dose.
Yeah.
Dr. Murthy, do you have anything to add?
No, other than the fact that I looked at the same group that you've been referring to, the SOGC, and they even clarified that if you do get pregnant, please don't alter your plans for your pregnancy by any means. Like if you intend to follow through with the pregnancy and took the vaccine, go ahead and do that. Don't make any alternative plans that you wouldn't otherwise in that situation. And so that this big organization supports that decision as well. It makes so much sense.
Maybe we should also, I just want to quickly describe what the SOGC is. I know that we, you know, said it was the Society of Obstetrics and Gynecology of Canada, but maybe Dr. Abrol, you could give maybe a 1 sentence on what their job is, what their role is, so people, you know, can put that into perspective and context as to who they are and why their opinion carries so much weight.
So they're a national organization of obstetricians and gynecologists of Canada. So they sort of oversee all OB-GYNs across the country. They have a handful of guidelines on various topics related to obstetricians and gynecologists. So you have experts in the field getting together, looking at data on any relevant topic, this one being COVID-19 and vaccines and pregnancy, and then using like proper data and proper evidence, giving out recommendations that then across the country physicians can follow. And it's nice because you want to know that there is a consensus on what to do and what not to do, and that it's evidence-based. And that's why we as physicians refer to these national organizations, because they sort of oversee an area of specialty of medicine, and they give a lot of guidelines and a lot of protocols and a lot of recommendations. And so you don't feel like your doctor's doing something different than the other doctor down the street. People are following national guidelines. I think it's really important, and you want to hear that your doctor's following national guidelines.
Amazing. So it's evidence-driven, there's consensus, and a very trustworthy organization. That's incredible. That's really good for our viewers to know as well. And, you know, just to put into context why, when they come up with their recommendations, why it has so much weight and why we follow them because it's so evidence-driven. So we've talked first. I want to go into some of the meat and potatoes, especially on the 3rd trimester. And I'll tell you why I'm so excited about this is because I have a background in immuno-oncology, and I find the immune system is just absolutely fascinating. And so, Dr. Murthy, you basically alluded to some of these studies that are coming out now about vaccines given in the third trimester. And so can you talk to us about what passive transfer of antibodies is, what it means in terms of protection to the fetus, and how we do this with other vaccines, such as Tdap that we give now in between 27 and 32 weeks, 36 weeks.
Kaajal will know better than the rest of us.
It's been 4 years since I've been pregnant, so it's a little, the actual guidelines are a little murky, but yes, Dr. Murthy.
So essentially, the whole point of passive immunity is when you're pregnant and you're the mother, your body has its own library, let's call it, of antibodies, which are basically proteins that your body learns of how to protect itself from infections. You may have gained them from infections that you've had on your own, like, for example, chickenpox as a child, or from a vaccine, like you mentioned, the Tdap vaccine, or even a chickenpox vaccine for comparison. The idea is that after a certain point in your pregnancy, some of these antibodies will start to get from your body through the placenta, which is basically the interface between mom and baby, and pass some of those protective antibodies to baby. We know that this has the potential in other infectious diseases of protecting the baby up until a certain point after their age. For example, the measles, mumps, and rubella vaccine, which protects you from measles, mom is supposed to be protected with that vaccine before her pregnancy. And so it's supposed to protect baby until they're about through passive immunity. So meaning from mama to placenta to baby, until the baby's about 1 year old. And that's when it gets its first MMR shot to protect itself. Full disclosure, I'm not a pediatrician. I'm not an obstetrician. This is me going through all the nitty-gritty of this as a mom myself who was wanting to be versed in all this information. With that said, what we're trying to learn about the COVID vaccine is where these benefits lie for COVID antibodies, or the COVID book in your library of protection from the infection. We're still learning the details of this, but there's nuggets of information coming at us every day in various papers that is starting to show us that maybe if mom gets vaccinated or mom's been infected with COVID and has antibodies cooking in their system, that there's a chance that some of those antibodies can get to the baby when you're pregnant. We've seen a few papers that have now started to show that these antibodies can be detected in mothers that were vaccinated in the cord blood. We don't know what this exactly means for how long the baby could maybe be protected with these antibodies, but we know that it's possible. And we know that there's something that happens from mom to baby to give it this opportunity for possible protection. There's a few studies that have come up to support this information, and we're certainly still learning more about what this means. But overall, I don't know about you guys, but I'm really excited about this. I think this is a big deal. I think this means that we have a chance, for how long we don't know, but to potentially protect babies with mom's immunity. And so that's what I would say about that. And that's where we know things right now in terms of passive immunity.
Amazing.
You had a few other questions to that. Sorry, I'll let you continue.
No, that's fantastic. And Dr. Abrol, do you have something to add to it, based on your own clinical practice as well?
No, I would say I'm kind of like with Dr. Murthy, like I'm excited about it, because I think we talk all about protecting women. We talk about severity of infection in pregnancy, wanting to protect women, wanting to keep them out of the ICU. But imagine, now it's twofold. Now we're not just protecting mom, we potentially are protecting baby too. It just, you see us and we're excited because we think we've seen the not so good side of things. If there's a potential for such a good side of things, to me, it's double the reason to run out and get pregnant women vaccinated.
Ultimately, it's the icing on the cake, right? Like the priority is for mom to get protected so mom doesn't get sick, because healthy mom equals healthy baby. But if there's a chance that maybe baby's getting some benefit, hey, that's awesome.
Yeah.
And what I've said, and maybe you discussed this last night with your pediatric infectious disease doctor, but for those parents out there that are concerned about immunizing their young children, there are even studies coming out about immunizations in young children. And I do think that's within the near future horizon. And so if you're feeling like, oh, I wish I was a pregnant mom and I wish I could get vaccinated to give my baby some antibodies, your turn is coming too. So just stay tuned is what I have to say to that as well.
That is such a great point, because we definitely don't want to get anyone anxious about this. But, you know, like you said, it's like really is, you know, the cherry on top of the cake. Like you get protection yourself as a pregnant person, but there's also a possibility that you might be protecting the fetus at the same time. And I think, I mean, just that concept and that idea truthfully excites me as well. And just listening to both of you talk about this gave me goosebumps. So it's fantastic. I love it. Okay, so I think one of the things that also comes up, you know, and I've received a couple of times where people are pregnant, they've gotten the vaccine, and you know, side effects are normal and common with vaccines. It just means your immune system is ramping up. It's doing what it's supposed to do. And so some of these, you know, could be things like fever, chills, muscle aches. And the question that I get very often is, as a pregnant person, what can I do to alleviate or to reduce some of these side effects and symptoms with the vaccination? So Dr. Abrol, maybe if I could go to you and get your advice on this.
I think we do very similarly to what the non-pregnant woman does, with some modification. So, you know, you'll often hear someone say, if you have fevers or chills or some muscle aches, take a bit of Tylenol or Advil after your vaccination. Well, sort of the same thing. We don't advise Advil or ibuprofen in pregnancy, so I'd stay away from that. But I have a lot of obstetrician friends who routinely tell their patients at, you know, 12 to 24 hours post-vaccine, just take some Tylenol to sort of protect you in case you do have any side effects. So it's very simple. I don't think it's very different. I mean, again, people worry about any of those side effects because they are pregnant, and I think it's normal to worry, but know that these are common side effects. And it doesn't mean something's wrong because you're pregnant. A little bit of Tylenol is okay in pregnancy. There's no reason to sort of suffer through it. Just take some Tylenol, have those muscle aches subside, or that Tylenol or that fever subside, and it will resolve. The good thing is these side effects are short-lived. You just have to get through them.
Yeah, and actually in pregnant individuals, in that paper I was referring to, the side effects were even less pronounced, for that matter, in pregnant women. So, which is interesting. And I don't think this means that your immune system isn't ramping up. I know that we talked about the side effects being a sign that your immune system's ramping up. Just because you're not getting the side effects doesn't mean it's not ramping up. But for what it's worth, pregnant women had fewer side effects in that New England trial. So take that for what you will.
It could also mean just the fact that pregnant people already have tons of, you know, aches and pains and all of the other stuff happening. And maybe we just have higher pain thresholds.
Maybe. You're just super people out there, that's all.
Super people, exactly. Yeah. And then maybe Dr. Murthy, if you could also do a quick clarification, because one of the other questions I get on the flip side of this is that, should I take Tylenol before I get vaccinated? And that comes up very often too. So if you could maybe address that.
In general, the advice is no. I mean, if it's part of your regular medications for other reasons, definitely talk to your doctor about whether it's a safe decision for you or not. There's no reason to take it, really. And there's some people that think that it might suppress your immune system's ability to react and all that. I say avoid it if you can, but if you're really sore and feeling unwell, go ahead and take it if you need to. But I would give the disclaimer that this is something you should probably run by your family physician or your primary care provider to double check that they're comfortable with that as well.
Excellent. Okay. We're going to still talk a little more about safety, because I think that really is one of the crux of some of the concerns and apprehensions that people have. And what has really happened in the last few weeks that has amplified people's concerns are, you know, blood clots. We're hearing so much about blood clots. And we also know that in pregnancy, you know, pregnant people can be at a higher risk for blood clots. But because of this heightened exposure and talk about blood clots, it's causing a lot of apprehension. So Dr. Murthy, maybe if I could start with you first, and then Dr. Abrol, I'd love to hear your thoughts too. Is there an increased risk for having blood clots with these vaccines in pregnancy?
So specifically for the majority of people that are going to get vaccinated moving forward now in Canada, the access to the mRNA vaccines has not been associated with these special clots that we've been hearing about that have been related to the adenovirus-based clots, which are made by the AstraZeneca and Johnson & Johnson companies. There was some news articles circulating about possible clots with mRNA vaccines, but I think that was a headline that didn't clarify that the number of clots that they saw in those trials were the same number of clots that you would see if you examined X number of people anyway. And so there is no evidence that the mRNA vaccines cause these clots. Certainly, we're learning so much more about the adenovirus-based clots. Even those are incredibly infrequent. Still, even as we're learning more stats and it seems more common than we initially thought, it's still a very rare event. And so anyone that's been immunized with AstraZeneca, congratulations, you're building antibodies, you're doing a great job, and you're protecting yourself. And I'd like to just tell you that we are so lucky that we have regulations and scientific teams to look for things like this, because now we kind of know how to manage that too, which is an important takeaway about the VITT special clots that we're seeing associated with some of these vaccines. For the majority of pregnant women moving forward in Canada, in all likelihood, you will be getting an mRNA vaccine where this risk is not appreciated. But maybe Kaajal can piggyback on the other clot risk in pregnant women specifically, because pregnancy, I understand, is a really hormonal state where you might have a risk for clots. It has nothing to do with the vaccine clots whatsoever.
No, it has to do with elevated estrogen levels. So elevated estrogen levels put women at an increased risk. There's several medical states that put you at an increased risk of clots, and pregnancy is one of them, related to high estrogen levels. But it doesn't, it's unrelated to vaccines. Even the vaccine that was associated with the clots, totally different mechanism.
Correct.
So many clot specialists, thrombosis specialists across the city and the country were trying to sort of let people know and educate people that it isn't the same sort of risk of clot. I mean, I think at the end of the day, it's a bit of a moot point now, because moving forward, we're not dealing with that vaccine in the pregnant population at this point. But I think even for those who were vaccinated, I agree. I don't think anybody needs to worry. Your risk was very early on too, and immediately sort of after getting the vaccine. So, and again, not a very high risk, but unrelated to your risk in pregnancy. It's a different risk in pregnancy. And so if you sort of have risk factors for clots in pregnancy, you know, your primary care provider will talk to you about that. But I don't think it's something people need to really worry about.
Yeah, and even the women that were pregnant that did get the AstraZeneca shot in the last couple of weeks, rest assured, like, this is something that people understand now. And so if you do have symptoms, if you're feeling unwell from that 4 days post-vaccination up until about 20 days post-vaccination, don't be shy to ask the questions and get the help you need. The system is still here to protect you. And so please ask those questions and be attuned to your symptoms if you have had that AstraZeneca vaccine, because I'm sure there are some pregnant women that still were eligible and totally did the right thing when this option was offered to them. So again, congratulations, you're building antibodies. That's awesome. Just watch out and take good care of yourself.
Such a great point. So no need to panic. There's absolutely no need for that. Absolutely. But going forward, you know, pregnant people will be getting the mRNA vaccine, and there is nothing in terms to be concerned about for these specific type of blood clots with the mRNA vaccine. So that's so reassuring for pregnant people across Canada, but especially in Ontario, given that we have paused AstraZeneca here anyways. Okay, fantastic. So moving along to, again, other safety questions that are really top of mind. Can any of the vaccines cause changes to DNA? And we also got a follow-up question to that in our Q&A. I'm monitoring our Q&A. So if anyone has questions, please do throw it into the Q&A box, not the chat box, but the Q&A box. I'm going to try and get to all of them if we have time. So the question is, can any of the vaccines cause changes to DNA? And subsequently, can it actually cause any changes to the fetus's DNA? And Dr. Murthy, do you want to start? I see you nodding your head, so I'll go with you, and then Dr. Abrol.
So I'll talk about the first part of the question, maybe Dr. Abrol will take the second half, I guess. Anyway, no, these vaccines do not modify your DNA. The goal of all the vaccines, whether it's the adenovirus-based vaccines or the mRNA vaccines, is to teach your body what to do if it sees COVID-19 infection. That's it. That's all it wants to do. So it sends you a little piece of information, either in a bundle of something called mRNA or carried in a virus that's basically inactive or not working with a bit of genetic information, where that is stabilized by some fats and some solutions injected into your body. The message, it meets your immune system and it teaches it how to recognize the spike protein. What is the spike protein? This is what makes coronavirus the virus that it is. This is what the dangerous part of the virus is. This is what your body sees when it sees coronavirus. If we're teaching your body how to see that before you get infected, then we're teaching it how to learn how to build its army against that. So we're learning how to build antibodies against that protein. There's no DNA manipulation to your body. There's no risk of congenital defects. And I'm not just saying this, congenital defects would be what we would think about if there was concern about DNA modification to your system when you're pregnant. We didn't see that with the trials that we have, and we didn't see that before these vaccines were authorized in pregnant women. And so the answer is no, this does not modify your DNA. If anything, it teaches your immune system how to fight the coronavirus infection.
Great. And Dr. Abrol, do you want to take part 2? Does it impact the fetus's DNA?
So the short answer is no. So it would, if it was able to alter the fetus's DNA, it would be doing the same thing in mom's DNA, right? The mechanism's the same, and it's actually, I mean, not doing that. So yeah, we don't worry about that at all. And then we would worry about things like birth defects, congenital defects, possible risk of miscarriage. And we're not seeing that. We haven't seen that. So we don't think it's affecting the fetus at all.
No. And to that point too, with the actual COVID infection, we would have seen those types of outcomes, which we didn't either. So it all kind of, it makes sense. Sabina, no. That's
awesome. You know what? And I think that some of the concern people have is just with the term mRNA, because it sounds so similar to DNA. It sounds like it's genetic material, but you know, the RNA, you know, is your DNA is your double-stranded, double helix strand, whereas your mRNA is your single strand that only has information. It basically is a recipe card. So I love to put into context. It's like you have a recipe card to how to make dal makhani, and then you know you send that recipe card to your body, and then your body makes your dal makhani, and then you know, and it basically all it does is that recipe card for it. And like my second analogy that I love using is, you know, as you said, you know, we're just making a spike protein off the actual virus. And I heard someone explain it in a way that, you know, pretend there's this bad guy with this massive mustache. You make the mustache, you don't make the bad guy through the virus. You were just making the mustache, and then your body makes it, realizes what the heck are you doing in my body, kills it, has a little logbook where it writes down that mustache, I don't like it. And then subsequently, when you actually come into contact with the virus, you don't actually know the virus, but you recognize the mustache, and you end up creating that army, you know, against it. So, you know, like you said, there's absolutely no impact to DNA of either mom or the baby, but all you get is really good, strong antibodies to fight off the virus. So it's all good in terms of, you know, what you're getting, which is fantastic. The other question we get is, what if we're due for another vaccine, such as the Tdap vaccine? Do we have to wait between vaccines? So Dr. Abrol, do you want to take that one?
So my understanding, but actually Dr. Murthy might be better at knowing this, but my understanding is we want them to wait. I could be wrong here. We want them to wait 2 weeks after. 2 weeks after.
Oh.
So if you've had one vaccine, you want to wait 2 weeks after that vaccine before you get the COVID vaccine. For the Addisol and pregnancy, the SOGC said after you've had the COVID vaccine, you should wait 28 days.
So 2 weeks before, 4 weeks
2 weeks
after.
before.
Yeah.
Okay.
But what I wanted to clarify to this is just 72 hours ago, 4 days ago, the CDC, which is the American Centers for Disease Control, has almost said maybe this waiting thing doesn't matter. And so I wouldn't be surprised, and stay tuned if they make this whole rule obsolete, because it was done with an abundance of caution. And so maybe as we've learned more and as the seriousness of the pandemic has changed, they might get rid of these gaps. And so if you're someone that's pregnant, maybe watching this video, today's date is May 18th. If you're watching it at a later date, you definitely want to talk to your provider to make sure that those rules haven't changed in any way.
I actually think that's a really good point, because even when we turn to these guidelines and these recommendations from national organizations, between March 2020 and May 2021, there have been so many changes and updates to the guidelines, because everything is evolving as more data comes out, more information comes out, and you want that, right? Because you want to do what's the right thing to do with the information that we have in the last 3-4 months, not just last year.
Oh, that's such a great point, to actually make sure that our audience understands that science is evolving and our recommendations evolve with the science. So I think that, again, it's very reassuring for Canadians to know that our health bodies such as SOGC, Health Canada, are staying up to date with all of the science and evidence and changing as we go. So good point to know that this is recommendations as of May 18th. It might actually be out of date May 19th. Who knows? But evidence evolves, science evolves, and we evolve along with that. What about those who are immunocompromised? So, pregnant people who are immunocompromised, is it safe for them to get the vaccine? And Dr. Murthy, maybe I'll start with you first.
So because immunocompromise could mean a million different things for every individual person, this is a very specific question to discuss with your maternal health care provider if you have another immunocompromising condition in addition to your pregnancy. For the most part, there are very few reasons to not get the vaccine, but I certainly wouldn't want to overstep or overspeak from a plan that you have with your care provider. So absolutely discuss with your doctor, your care provider, if there's any concerns with other conditions that may put you at risk from getting the vaccine. I will say, if we are talking about other medical conditions, it's incredibly important for women that are mothers, that are pregnant, that are obese, have gestational diabetes, or of advanced maternal age, meaning having their pregnancies a little bit later in life, to be mindful of the fact that you are someone that should seriously take those other conditions very seriously during your pregnancy. And Dr. Abrol can probably elaborate on why that's important in general, but specifically in COVID, we've seen that people with these conditions can potentially be at higher risk of severe illness. And so you want to get a vaccine for sure.
Great. Dr. Abrol, do you have anything to add?
Not really. I mean, I think the one thing I would say is you're right. I think at baseline, if you have any of those issues in pregnancy, you want to be extra cautious with your pregnancy, because they put mom at risk of certain things, they put baby at risk. So it's just more of a high risk or cautious pregnancy to start, but they're definitely risk factors for more severe COVID infection. I think all the more reason for anybody with any of the conditions you listed to get a vaccine ASAP and to take really good care of their health.
Amazing. Okay, fantastic. So I think we've covered some of the top pregnancy-related questions that we get. So let's switch gears a little. What I'd love to talk a little about is people who are trying to conceive or are undergoing fertility treatments. So is there any concern with getting vaccinated while you're trying to conceive? Specifically, people want to know whether the vaccines can impact fertility. We've actually gotten quite a few questions in our Q&A box right now asking this question as well. So maybe Dr. Abrol, if we could start with, do these vaccines impact fertility at all?
So the early data shows us that doesn't seem to impact fertility. And so when I say fertility, we sort of talk about the female side of things and the male side of things. You know, there aren't a ton of studies. A lot of what we know is anecdotally. You know, across the United States, they have been vaccinated a little bit faster. And so you're hearing sort of anecdotal from different fertility clinics and early studies looking at this. But the early studies don't. I can tell you that I recently looked, it's a small study. It looked at about 36 couples who had actually done an IVF, an in vitro fertilization cycle before the pandemic, and then in a short time after. So 2 cycles. And I like it because you're the very few situations where we can compare the same person or persons before and after vaccine. And it showed in these couples in many different parameters that the vaccine didn't show a difference. So things like the number of eggs, so the amount of drug they used, so how much stimulation a woman needed to get a good response, the number of eggs that the woman was able to get in her IVF cycle, the number of good quality embryos that couple produced in their IVF cycle, and then the sperm parameters, the count of the sperm, the motility of the sperm. It's a small study, again, 36 couples, but I think it's promising because it's showing you both sides of the equation, the female side and the male side, and it's showing you before and after in the same couple. So I think it goes to show you, it's one example of, we have lots of little examples of, you know, we did hormone levels in there was a study, an observational study in Wuhan looking at hormonal levels of women before and after infection and whether those hormone levels were different. But I like this study because it's showing us before and after vaccine in the same population. I will say this, however, so I like the study, the early data showing us that fertility doesn't seem to be affected by the vaccine. But on the flip side, there are some really good studies showing the impact of COVID-19 infection on fertility. So one particular study for me comes to mind. It's a small study. It looked at 43 men who had gotten COVID-19 infection or tested positive. And it divided these gentlemen up into the severity of infection. So it looked at men with a milder infection, not hospitalized. It looked at men with moderate infection, hospitalized, not in the ICU. And it looked at men who had severe infection, were in the ICU. And in all groups, it showed that the sperm was affected. So in the milder group, it showed that their motility was declined a little bit lower than normal. In the moderate group, it showed that the count and the motility movement of the sperm was affected. And in the severe group, it actually showed that these men had what we call azospermia, or no sperm count. We know that sperm is sensitive to infections and illness and viruses. This is not new information. Mumps is a perfect example. Mumps infection can lead to also azospermia, no sperm in the ejaculate. So that part isn't new. We also know that sperm has a life cycle of 90 days. So sperm's pretty resilient and guys are always making new sperm. So I'm not here to scare anybody. I'm not trying to say that if you get a COVID-19 infection, you're now infertile. The hope would be that over time, the sperm would hopefully in the following 3 to 6 months improve, possibly get back to baseline, depending on how affected it was. But my point I'm trying to make is we have seen that the vaccine doesn't seem to affect fertility, but we do have some good evidence that it affects male fertility. We haven't seen the same things, the COVID-19 infection in female fertility, which is reassuring, but we have seen it in male fertility. So to me, this highlights the importance of getting a vaccine while you're trying to conceive, because it really can protect your chances of conceiving and sort of obstacles you may run into.
That's such a great point, putting it into perspective with not just the vaccine, but also what happens with COVID infections is so incredibly important, because at the end of the day, you do risk-benefit analysis, right? And here you can see that the risks of getting a COVID infection far outweigh in the sense that they are far graver than, any. At this point, basically, it's just concerns that are theoretical in the sense with these vaccines. So it's really good to know that COVID infections themselves pose a lot of risk to those who are trying to get pregnant and those who are pregnant. That's really good to talk about. And I guess, you've sort of already mentioned it, but maybe if we could, take a couple more minutes and talk about just those who are trying IUI, IVF, other fertility treatments. Have you noticed any differences in terms of successes with it after getting the vaccine?
Yeah, no. So I think this is really good. I think it's still really early, as vaccines across many countries are rolling out. One of the studies that I spoke about, that before and after vaccine study, came out of Israel. So, there aren't a ton of studies, but they are being done. They're smaller right now because the number is small. But I would say anecdotally, we're not seeing it. Even my colleagues in the United States are not seeing sort of worse responses or treatment affected by the vaccine. So I don't think it's a reason not to get the vaccine.
Okay, that's good to know. What about menstrual irregularities? Because that again is, there's so much mis and disinformation, especially on this, and a lot of conflation of issues with respect to, changes in period versus fertility. So perhaps, maybe I would go with you, Dr. Abrol, and I'd love to hear, Dr. Murthy, your perspective as well on, what's going on with this. What's the truth, and how much of this is basically untrue?
So I'm happy to give my perspective, and I'm really interested to hear yours, Richie. So for me, I mean, you hear a lot of hype, especially on social media recently, about women reporting changes in their menstrual cycles after getting the vaccine. So the two sort of more common things you hear about are heavier menstrual cycles or longer menstrual cycles. So I will say that there was a study that was done in China, and it looked at women who had the COVID-19 infection or tested positive, and about 25 to 28% of women had actually reported either heavier cycles or longer cycles. And the thought or the hypothesis was that it was during active infection, and it was very transient, lasting 1 or 2 cycles. And they felt that maybe this was the body's response to the immune reaction, right, of having an infection. So one could extrapolate, and if we say that when we're getting the vaccine, our body is doing the same thing or the same type of thing as an infection, whereby we're sort of mounting an immune response to later protect us, one could extrapolate that it's the same sort of thing. It's an immune response, and that the body is sort of getting you ready, and it should be transient. That being said, I'm not here to say that the body's immune response is to make your cycles irregular, but I say that one could compare it to that and say this is a possible hypothesis. If it is true, it should be transient and only last a cycle or 2, and that's what was shown in the previous studies. So I would add the caveat that if you do notice your cycles were a bit different, changed a bit more heavy, a bit longer after you got the vaccine, I would monitor it. And if it lasts more than 2 or 3 cycles, I think I would see your primary care provider to look into something, because our instinct always is to point the finger at the thing you just did or just had, the medication you just took, but it's not always true. And it is possible that there's another cause totally unrelated to getting the vaccine, and it's important to acknowledge that.
Yeah.
Mm-hmm. Yeah, correlation is not causation. I think that's such an important point. Dr. Murthy, your perspective on this?
So, I mean, taking it to the other side of the female health spectrum, again, just a public service announcement, if you are postmenopausal, not someone that's dealing with fertility, but on the other end, and you do see bleeding after a vaccine, it's incredibly unlikely and not proven to be related to the vaccine. And it could be a red flag for something serious. So don't chop it up to, again, something that you were just exposed to. See your doctor because you want to have that explored. What I was talking about with my new friend Kaajal, candidly, was about how I think that this really highlights a gap in science. And I think as women and the South Asian women, we in the sciences, we sort of owe it to one another to make sure that as we move on in our fields, that we make sure that women are equally represented. Because even those that are having a day or 2 of changes to their periods, it can affect your mental health, and it can affect your day. And so we've never really done this for so many other drugs out there, looked at how it affects the women's experience. I looked into this a little while ago because I was curious about vaccines and menses, and what you're saying makes complete sense. But the only other information that I found was a study that they did in Japan after they'd started using the HPV vaccine and documenting menstrual irregularities in women back then, which were, again, short-lived, very immediate, not a big deal, and not correlated with the HPV vaccine, which is a vaccine that protects you from possible strains of viruses that can cause genital warts and cervical cancer. So the point is, I think we all have a shared responsibility to make sure that women's health issues are represented in the sciences. And I think as women in science, we can lead that cause.
Such a great point. I completely agree. I think that we should be spending a lot more time and a lot more resources into things that impact and affect women. And very often, we see that there's a lack of funding, lack of resources that are geared towards pregnancy, towards breastfeeding, towards, menstrual cycles. And I think that this should be a great impetus for us to actually increase funding and resources in these areas. So such a great point.
Sure.
So let's close out the fertility section. If I could just, Dr. Abrol, get from you maybe, in 1 or 2 sentences, impact on fertility with the COVID-19 vaccines, because, I think half of our questions in the Q&A were about that. And so maybe just a, really succinct 1-liner or 2 lines on fertility and vaccines.
Early data does not show an impact on male or female fertility from the vaccines, but there is convincing data to show an impact on fertility from getting the infection, particularly male fertility. So I would strongly encourage everyone who is trying to conceive to get the vaccine as soon as they have access, because it will protect you, male or female.
Love it. Okay, fantastic. The other set of questions we've gotten actually have to do with chest or breastfeeding. So those nursing parents. And so I'm going to start with asking the question that is top of mind for a lot of our attendees today. Can I get the vaccine if I'm nursing? And then, I also wanted to give some flair with respect to some of the questions that I've received very often. So, I get questions from people who basically say that they're nursing their infant, and then they hear about antibodies that could be, offering protection, and should they be pumping and giving some of the breast milk to an older child in the house? And on the flip side, I also get questions about people who cannot nurse, who are not able to nurse, and then they feel this guilt about not being able to pass on antibodies. So I guess this is a 2-parter question. First
this
part
is a layered question.
It's a layered question, and we're here to talk nuance, and so I'm really up for this if you are. But what about A, safety of getting the vaccine in nursing, and then B, let's talk about antibodies.
Okay, let's start off by saying that there is scientific evidence that shows, and there's a few studies that have proven this, that vaccines in those that are lactating versus the regular population did not show any signals of side effects, adverse effects than you would expect in a person that was not lactating. So let's put that off the table and say that yes, there's proof that it's safe. And adding to that, there's no reason to believe that it wouldn't be. There's no way to assume that this process would cause any issues with the content of your breast milk. And I know, especially as a South Asian recent mom, there's a lot of people that tell you things that you eat and different things that you may ingest may have an impact on your breast milk. I'm still looking for the scientific data to back some of these anecdotes that I've so kindly heard from people I love in the last year. But I will say that this is not one of those things to be concerned about. And I have to say, breastfeeding is so hard. I don't think breast pumping, chest feeding, all of these things, raising a baby is hard. And so please remove the stress and the pressure of this from your plate, because there are so many other things to try to manage with. And ultimately, and you guys can agree or disagree with me, but fed is best. Do what you can to feed your baby, and that's what matters first. Now, there are some benefits that we've seen with breastfeeding in certain populations, and it's specific to COVID-19. What we've started to see is some exciting signals of there being antibodies in breast milk of women that were vaccinated with the COVID-19 vaccines. This is exciting because for those of you that are intending to feed your baby with breast milk, good for you, first of all, and congratulations if you want to pursue that, that's good for you. And if you don't want to, that's good for you too. But if you are, there may be the added bonus of passing some of these protective antibodies that you've gained from the vaccine to your baby. And we've seen this. We've seen this in breast milk. We've seen this in a few studies that they've done with lactating mothers that have been given the vaccine, and they've measured the amount of antibodies as time has gone on to see if those antibodies build in it, and it seems as if they can. A few things that we still don't know about this information is, one, how much of that is really protective to baby? Can we say that a certain amount that mom's giving baby is going to be protective? We don't know for sure. And we don't know how long those benefits could last. And so if your goals are trying to get your baby protected through passive immunity, as we've already discussed, your odds are much better of getting the vaccine when you're pregnant and passing those antibodies to your baby instead of through your breast milk. Now, we know through other infections and other research into breast milk that probably the most potent or the most bang for your buck breast milk for antibodies is those that you just develop right after having delivered your baby. And so beyond that, it's hard to say how much of those antibodies are really protective or beneficial. So I've been asked this question a bunch before too about older children and sharing your breast milk. The truth is, it's probably, there isn't enough evidence to say that it would be helpful, and your body changes as you get older. You don't digest things in the same way. You don't protect your gut and your lungs with the antibodies when you're a teeny tiny baby compared to even a toddler. And so if there's any benefit, my guess would be that it would be very soon into the newborn period and unlikely past that stage. But I still think there's so much to learn about this. Again, exciting information. So keen to hear more. And there is certainly a chance that some of your antibodies that you've built as a vaccinated mom could get to the baby through the breast milk. Yeah, so those are some of my thoughts on that.
Good to know. So there's no safety concerns whatsoever with those who are getting the vaccine and want to breastfeed, but there is a small possibility that perhaps there might be some protection in a specific time period that could be passed on to the infant. Yeah. But if you don't nurse, that's also not a huge issue, and unlikely to be of huge significance to the baby.
And again, to that point, if you want your children to be vaccinated or protected from COVID-19, the odds are you might get a shot at a vaccine sooner than you think. So stay tuned.
And Dr. Abrol, do you have anything to add to this?
Not really. I think Richie said it perfectly.
I'm very passionate about this. It's been very challenging.
I believe you.
I hear you, and it's actually a question that again comes up very often in our evidence-based parenting group. It's focuses on feeding and how do you feed your infant, and it's one of the questions that I answer also on a daily basis because it is on everyone's mind. And I think that, empowering people with this information and this knowledge, especially for new moms who are already overwhelmed and stressed out, and like you said, trying to keep, a baby alive, it's hard. It's really hard. And I think we should acknowledge as that the fact that it is hard. Okay, so the other question that have come, and actually these have come through email, to us has been, so there's two-part questions. I have had 3 miscarriages. Does COVID-19 vaccines cause miscarriages? And second, is there an increased preterm labor with mRNA vaccines? So I'll open it up to whoever wants to take it first.
So we don't think there is an increased risk. We don't think, and we haven't seen that there's an increased risk of miscarriages. So I'm really sorry that you've had all these miscarriages, and a miscarriage is not an easy thing to go through, let alone 3. So I totally hear the nervousness and the hesitancy. I would reassure you that the early data does not look like there's an increased risk. So that's really reassuring. And I think once you do get pregnant and get beyond miscarriage risk, you would want to be as protected as possible in that pregnancy. So for me, I would say, given what you've gone through and given the data that we have on vaccines and vaccine safety, I'd encourage you to get a vaccine.
Yeah. And I would encourage you to modify your other risk factors in addition to the vaccine, because you want to make sure that you're preventing other risks of COVID-19 infection, meaning the people that are in your household, if they're able to get vaccinated, encourage them to get vaccinated. Make sure that if you're in a workspace that allows you to work from home, try to do that too. Whatever you can do to minimize your risks, continue to follow public health guidelines with your masking and physical distancing. This is also important. Because ultimately, even though the vaccines have been proven to be very, very safe, the infection itself is not. And we do have concerns that are real for pregnant women in COVID-19. And so do what you can to protect yourself and your family so that you can have success with this in the future.
Such great points. And you know what, I actually would want both of you to sort of take some of what you just said and put it in a lockbox in your brain, because I kind of want those to be some of the last parting thoughts that we share with everyone. You know, just takeaways from what we've discussed in the last hour and 15 minutes. So the last question I want to talk about is the second part of this question, which is preterm labor with mRNA vaccines. Has anyone seen any increased risks with that?
No, and there were successful third trimester deliveries with those that were vaccinated in that other very important paper I talked to you about earlier in this chat. So I haven't seen anything to that effect. On the contrary, the infection does raise the risk for those side effects, which is why I encourage you to get vaccinated and protect yourself.
So important distinction is that with COVID infections, you do see an increased risk of preterm labor, but we've not seen that with the vaccines. Amazing. So we have 3 minutes to go. We've had such an incredible discussion today. I have learned so much from both of you. And so incredibly grateful for your time, your expertise, your knowledge sharing, and also the fact that here we are, 3 South Asian women having this fantastic discussion. It blows my mind every single time, I won't lie. And so, you know, what I would love to do in the next 2 minutes is if I could give each of you a minute to, you know, share your key takeaways with the group on, you know, what either pregnancy, fertility, breastfeeding, you know, or all 3, if you could in a minute, give us your key takeaways. It would be so helpful for everyone as they're leaving this panel tonight. So Dr. Abrol, I'll start with you.
Every day I see women and couples having trouble getting pregnant. So my population is very unique. And ultimately, at the end of the day, I want to help them do what they want, which is build a family or start a family. The reason I agreed to do this talk and was so excited to be invited is because at the end of the day, we have seen so much about how COVID infection can affect people's fertility and people's risks in pregnancy. And so for me, any young person who is trying to get pregnant, who is newly pregnant, who is partway through pregnancy, I really want them to protect themselves. A lot of what I target is the person who's trying to get pregnant because that's who I see every day. But I'm just as passionate about protecting the pregnant patient. So if I could I know people are so worried about putting anything into their body, doing anything that would affect their chances of pregnancy. But the data is pretty reassuring. And so for me, if you are trying, if you are early in pregnancy, female, male, doesn't matter. I strongly encourage you to get vaccinated. Protect yourself now. You don't have to stop trying. Stay on schedule and it will help you.
Thank you. Dr. Murthy?
To echo the same messaging, I mean, these are exceptional times. These are not easy times. And like so many probably listening, we're all missing our families, or we've lost people we love. We just are craving the human connection and the human interaction so much. And I have to say that although it's so important to follow public health guidelines, maintain your social distancing, maintain your masking, keep doing the good job that you've been doing for all these months, get your vaccine and keep at it, because that's our way out of this. That's how we get to share these hopeful new babies that Dr. Abrol is going to help with, and make sure that they get to meet their nannies, nanas, daddies, dadas, tatas, and all these extended aunts and uncles that so many of us in the South Asian community are so connected to. I can't wait to introduce my daughter to all those people. And I know that vaccines are my passport out for that. And so I encourage you all to do the same.
I love that. What a beautiful note to end this with. So I just want to take another quick second to thank you both. So immensely grateful to have both of you on here today talking to us about COVID-19 vaccines and reproductive health. I also want to quickly share our last screen over here, which is our website. If anyone has further questions, wants additional materials, we have tons that are available on our website. We're also going to be posting both the Punjabi as well as the English version of this panel on our YouTube, which is again under South Asian Health Network. So if you want to come back, you want to share this with other family members, your friends, please feel free to do so. And with that, I'm going to wish everyone a wonderful evening. Take care of yourselves, take care of your families, and we'll see you back here in another town hall on a later date. So thank you so much, everyone. Take care and goodbye.